with the recent RFP that we've been able to successfully win through WSIB, we can now actually provide funded surgical care to injured workers in Ontario, which was something that has not been done in the past. And I think we are poised actually to make a significant change in how healthcare is delivered, at least to the injured workers in Ontario. Why other institutions haven't done it? I think it's because the mindset and the philosophy of the University Health Network, I think, is very different than most hospitals in Ontario. I think traditional model of publicly funded healthcare hospitals is to deal with what their global budget of funding is and manage to keep that budget balanced. I mean, that's been the focus of most of the hospitals in Ontario. I think very few, if only UHN, has actually had the foresight to actually think beyond what its current accountability is, to actually look at how they can actually make a major impact to the healthcare delivery within Ontario and nationally. And that's part of the vision of UHN, which is to achieve global impact. So the problem we have in Ontario today is the system is very fragmented and siloed. A person has an injury or has a healthcare problem, they see one healthcare provider, then they are referred to a second healthcare provider or to a rehab facility, or they're waiting for their investigations or an MRI, and these are all services that are present, but they're fragmented. There's no integration, and you may go see your family doctor, and then you may wait 4 weeks to get your tests back, and then you come back to see the family doctor, then you wait 6 months to go see a specialist who then orders an MRI, then you wait another 3 months, and before you know it, a year's gone by and you still haven't had a resolution to your healthcare problem. And that's a very patchwork-based healthcare system. To move towards an integrated system which provides the right care always, the vision would be you come in to see the physician, you have your access to your diagnostic tests within a few days, you see the specialist, the right specialist, in a timely fashion, have your tests done, and you have a diagnosis and a treatment plan done within a week or two rather than 9 months to a year. And if we can actually throughput the patients to the right individuals appropriately, it'll actually decompress the burden of work that's being done by all physicians and all healthcare providers, because they're getting to see wrong referrals. So you should not come to see me as a hip and knee surgeon with a back problem, because I can't help you. And you waited 6 months to come and see me, and it's a back problem, and all I end up doing is saying, so I don't treat backs, I will now refer you back to your family doctor, who will now send you to a spine surgeon, and you wait another 6 months before you get to see the right person. That's a broken system. So when we say the right care always, it's that case integration and integration across the entire healthcare continuum.